want to see what I look like live.
You ready?
I'm ready.
What's going on, guys? Welcome back to Code Blue and Bullshit. It's Cordero.
And your girl, Monica.
So we're going to start this new type of series where we're going to be answering questions. And I'm just really going to be picking Monica's brain and give her the opportunity to pick my brain some too. So the first question I want to ask you is, what do you hate most about ICU nursing?
I think something that I hate most about ICU nursing is that term, how older nurses kind of eat their young.
Mm-hmm.
I don't get it. I was gonna say I kind of get it, but I really don't. I think it's toxic for the environment in the workplace, and I'm currently experiencing it in my new job. I switched jobs into like a CVICU unit, and they definitely eat their young. I mean, granted, I only have 1 year of experience, but still, I've never understood that phrase because you have to always remember where you started, regardless of your experience with the preceptor that you had, and depending on how toxic they made you feel in this environment. I feel like that you should take that and not run with it, and instead change that because you knew how uncomfortable that made you feel. So why would you want to, I guess, have that same experience for somebody that's coming on board?
Do you think it's because they get jaded? Like you get so much experience, you're just like, yeah, I'm the shit now. And just feel like you can, like, do you think it's an intentional thing? Or do you think it just kind of happens?
I don't know. I'm not quite sure just yet, but I can just tell you that it's toxic, and I think it's just really inappropriate. I don't think just because you have a certain amount of experience and you're knowledged all the way up in this specialty, that doesn't mean that you should carry it forward and welcome people with that attitude. Like I said, you have to remember where you started, and being in a CVICU unit, it's pretty difficult and to understand new concepts, especially coming from a neuro ICU where it's the complete opposite. You know what I mean? It's a whole nother a system that you're dealing with. But even just the environment, finding things, how to locate certain policies and procedures, how to just even be a part of the unit. You know what I mean? Just to take care of something really simple. So I feel like eating your young, especially in the ICU, can be a really toxic. I don't know. It could be a toxic starting point for somebody that comes in, especially with no experience at all. They're fresh out of school, and here they are getting ate by their, whatever the phrase is, by the senior nurses.
Especially the residents, they can be like, forget this unit. Like, I don't want to work here, and like really not want to work in the ICU again.
Exactly, and I just think that's one of the most things that I hate about the ICU is that some nurses can be very mean. And to answer your question, do you think that they get jaded? No, I think it's an ego thing. Every nursing specialty is important, let me just say that. But being in ICU and then just going into certain specialties, I feel like their ego just gets big because you are smart, you do know a lot, and I think that it just gets, it takes over their ego, and they think that they are the shit at the end of the day, which is fine. But you can think you're awesome, but you don't have to be mean. And I think that's huge.
That's fair.
What's one of the things that you hate the most from being in an ICU?
I think I hate, but I really dislike super, super busy days with critically ill patients. And just how...
Pause. It's called intensive care unit.
I know, but sometimes we get the step down patients that aren't as difficult as far as like your brain work, how much brain work you have to use.
Right.
But if you have two patients that are critically ill and you're titrating lots and lots of medications and managing lots of orders, you can get so tired. Hey, by the end of the day, you're tired. And you see that when I come home sometimes. I'm like, I don't want to talk. So that's what I hate most, is just coming home drained and then having to come home and still have emotional support and love for you and like the dogs. Like, I just can't come home being an asshole. Like, I don't like that.
Yeah.
But
I feel like I like those extra busy days though.
Man, now you be coming home drained too.
I do come home drained, but when I have a slow day, I feel like I'm staring at the clock, even being in ICU, and you're just kind of like, oh my God, can this day just hurry up?
It's only 12?
It's only 12 o'clock, and these are the patients that are like on Airvo or, whatever y'all call it, and that's the only reason they're in the ICU because they they can't get weaned off of that. So it's just kind of like, oh, I'm just like passing meds right now. This is so boring. So when I have crashing patients or really, really busy patients, even in this new unit with me not knowing much, my day goes by so quick.
Oh yeah, it goes by fast.
That I look at the clock and I'm like, crap, I haven't even charted anything. I need to get situated. But I can see what you mean, especially after that second or third day. You just like, I don't want to talk to anybody and I have to come home to my family.
You know, I've never really had like the nurses eat their young type. I don't know if it's because I'm a guy.
I think it's because you're a guy.
Do you think it's because I'm black? I'm a black guy?
What is that? They think what
I don't know,
what does
man.
that even mean?
Because I feel like society has a certain view on black men, you know, as being aggressive and as being just like very outspoken. And like subconsciously, like I'm not there like, oh, that's a black guy, we're not going to press him. It's probably like just a subconscious thing,
right.
You know, especially things on the media and they're like, oh, like I don't want to cross any
I don't
barrier.
want to offend him.
Right.
I mean,
right.
Maybe that's a benefit.
I'll take it.
I think talking to my preceptor, who's a guy on the unit, he said he had a little bit of trouble with, you know, his preceptor, that she was a little like mean or whatever. But I think it's not as intense as it is for girls, and maybe women, we just
y'all are freaking mean to each other.
We overthink
y'all are so
things,
catty.
so maybe that's why you've never experienced that. Plus, you're a pretty big guy. I mean, and most of the nursing field is women, so I think they probably see and they're like, I want to tell him not to do this again, but I'm kind of scared to tell him because I don't want him to beat me up. Maybe. I'm just kidding, though. But
beat them up.
No, all jokes aside, I think it is. Honestly, I think that new female nurses and new residents, or even when you're switching a specialty and you're getting trained on a unit and you're a woman, they get hit harder than guys do in terms of difficulty, you know, eating their young, like all of that. I think women suffer from it more. And I don't know why. And I think it is just a girl thing because y'all are guys and y'all don't have emotions and y'all bottle things inside and you care but you don't care. And I think that's why it's like that. You know what I mean? Y'all don't really dwell on things. So if you do get mistreated or whatnot, I don't think y'all would take it. That's the thing. I don't take it either, but as women, if I say something, then, you know, they're going to tell me to pipe down or tell me that I don't know everything and I should take advice or I don't know how to take criticism. I think it is a woman versus a man thing.
Okay.
And it sucks.
Okay.
Yeah. Yeah, because whenever I told my preceptor, I was like, hey, you got to back up. Like, you know.
Got you.
Like, you know, she was a little upset at me for a while, but we got over it. But I just couldn't understand why she was upset at me. So I do think it's just a woman thing.
Okay. We'll take it.
Yeah.
I like that answer.
Thanks.
Okay. So that'll be one of our episodes for our podcast. Well, yeah, we got the podcast at Code Blue and Bullshit. It's on Apple, Spotify. I think we're just gonna be promoting it specifically on Apple because if you ain't got an Apple, then you know you lived in the past.
That's fucked up.
I mean, it is what it is. Wait, it's 2020. So that was what do you hate most about ICU nursing?
If you guys have any questions, please, wow, I can't talk. Please feel free to ask that you want to know about us. And we're making podcasts right now, just for those of you that have joined.
Okay. So, and we've been trying to like cluster our content. So we're about to go ahead and record another episode. We're going to do about 3 right now. So let's see. Okay, I got it.
Is there a way to pause that?
No, you can't pause live.
Oh.
It's just going.
We can just do the intros after.
This question is, what would you consider patient neglect?
Wow, that's tough. I think I would consider patient neglect in terms of, let's say it's your loved one in that bed, in that hospital, and you're the nurse. And not saying like any extra treatment that you would do for them, but anything that you wouldn't cut corners on, but you cut corners on somebody else, I think that's neglect. You don't think so?
I just think if that's your standard, there's a lot of neglect going on in the hospital.
There is a lot of neglect going on in hospitals. What do you mean? That's not even up for debate. But I think that that's a good way to determine if you're neglecting your patients. Are you taking care of this person like you would take care of your loved one, busy or not? Would you advocate 100% for this person? Would you not cut any corners? Okay. That means making sure you give all that med through that, G2 or NG2 that you just water down.
Yeah.
It's important because if you think on that mindset and you take the time away on how busy everything is from your day, I feel like everyone would be really well taken care of. That's what I consider neglect. And I think that's big. If every nurse had that mentality, I think that, I don't know, there wouldn't be a lot of bad stuff happening in nursing.
I just feel like human nature wants us to cut corners. Like human nature wants us to make things easy, and not doing things the proper way makes it easier.
I don't think so. I just think people get really lazy, or they get really caught up in their days that they fail to prioritize, or sometimes you are just too busy to do certain things, but it also goes along with communication. I don't know. I feel like if you treat somebody with not the same respect that you would treat your own loved one in a hospital setting, then I think that's what neglect means in healthcare.
That's a good standard.
Sometimes, I'm not gonna lie, sometimes I'm doing something and a patient's making me frustrated or something like that. I have to step back and take a deep breath, and I always remind myself that, like, if this was my grandma or my grandpa or my mom or you laying in this hospital bed, how would I treat the situation? And I think it's really important because it is such a sensitive topic that we like to think that, your loved one goes to a hospital and they get the best care possible.
Yeah.
But it's so much more complex than that. So much more complex. So, what's your opinion on neglect?
Patient neglect. I think just not doing things the right way when you know that they should be done a certain kind of way. Like in your head, you know that, for example, like IV tubing need to have the green Kuros caps on them, but you're just kind of like,
yeah,
I'll do it later.
They're not gonna get a clapsy.
It's not that serious, Like you said, that's why people get infected and stuff like that. And like, I hate when people chart that they did Foley care, and I go in there and cleaning the Foley, and there's pus all over the penis head. I'm like, what? You didn't do no Foley care, and this is why we get, cauties and stuff like that, and it's messed up. It's really messed up because you know what you're supposed to be doing, but instead of doing it, you're just kind of like, we're good. It's not that important.
Right.
And that really can harm patients, and it's just not right. It's just not ethical.
And I will say, on my last hospital, I was part of their skin committee, and so I, looked at charts and was trying to come up with interventions on helping to prevent skin breakdowns and skin injuries from happening, whether it was device related or just pressure related from not turning your patient. And we were pretty busy in our neuro ICU, but then now going into a cardiac ICU standpoint with COVID, we take all the COVID patients there, whereas in the neuro ICU we just took pure neuro and surgical patients. It's so much harder to turn your patient. It's so much harder to make sure that there aren't any devices that are in their skin or that we're out of our sight and are causing injury. So I see the standpoint that nurses say like they're too busy to do this, but I think that you just have to make time and prioritize it into your day and make it a routine, make it a habit to turn your patient and prevent these injuries from happening. That also falls into the neglect category.
I did that. See, I like these short, little, sweet episodes because I can really pick your brain. Okay. We'll go ahead and stop the live then. Peace, our one person that's tuned in right now.